Good morning everyone, this is Nguyen, and in this video I'm going to demonstrate an open version of health information system dedicated for clinic and hospital management. And currently we are looking for business collaboration to extend further the impact of our product or to get validation for its functionality. So if you are interested in this project, please contact us for any future working opportunities. Okay, so now let's get started. In this project, you can find the quick demo links. We have prepared some of the account demo for you, the EMR and the pass, and a quick introduction about our system. The complete platform consists of multiple modules ranging from the HIS health information into AI, ERP, and CRM. But in this particular repository, we are going to take a look at the HIS department only, and it consists of the PASS and the EMR. And so for the PASS stand for the patient administration system. It is dedicated for the receptionist to manage patient profile and also booking appointment with patients. He or she will have the ability to admit the patient into EMR system and also make payment and export invoice for the patient. And for the EMR, it is where the doctor have the forms to perform medical examination. Also, the system collect medical data point for future query or even for AI training. The system also consists of the medicine and medication management for the doctor to review. And finally, the admin system is dedicated for the internal organization to manage the hospital human resources, also configure the branding and set up satellite clinics. He or she in the admin system will have the ability to set up the available medical services and also complete customization of available medical form for the doctors. I think that is it for the quick intro, and there are several ways where you can run our projects. The most easiest thing is that you use Docker Compose, or you can try out our quick demo link. Okay, so let's take a look at our PASS system. Let's log in with a test account. And in here, in the dashboard, the receptionist has the ability to review all of the booking today, or he can create new booking for a patient. He can select to search for an old patient in the system, or he can absolutely create a new patient profile if this is the first time the patient comes to the office, and then select the appropriate medical service for the patient. The profile is available for the receptionist to review as well, and also select the booking day and booking time if the receptionist need to book in advance for an appointment. And if the clinics is set up as a satellite, then the receptionist can also book an appointment for another clinics that is within the network, and the receptionist in the appropriate clinics also see the appointment and also have the ability to check in the patient when he actually come to the clinics or hospital. And the information is displayed as follow. The patient needs to take some of the service, and that service contains some of the assessment and procedures, and each of the assessment and procedure is going to be delivered by some doctors and in some room, and the receptionist gonna have the ability to review the overall payment of the patient and then click admit the patient into the EMR. Then in the dashboard, the receptionist has the ability to monitoring the status of the patient, how much time has he been waiting between each of the assessment to better understand the patient. And what about the EMR? In here, the EMR belongs to the doctor to perform the diagnosis, so let's log in as a doctor in the EMR system. And as you can see, when the doctor log in, he already see the patient admitted from the past, and he can absolutely review how many patients are there in their queue to be taken care of. When they click into one patient, then the profile of the patient is displayed. The doctor absolutely has the ability to review multiple patient profile at the same time. It displays as a tab like this one. And similar to the past, the doctor also have the ability to review the personal profile of the patient. And the main tab is divided into more tabs for the doctor to review the data. The first is the overall review data, containing all of the general information about the etiology and the chronic disease of the patient, so that the doctor have better understanding about how to treat the patient. And also review all of the last visit of the patient. There is also a progress tab where the doctor have the ability to see the past diagnosis, prescription, and also data point taken from the examination. And in the examination tab, the doctor have the ability to input all of the data in a chronological order. The first thing is the chip complaint. He collect the chip complaint from the patient and given it as a note in here. He then perform a general checkup for the patient. It usually contains some of the simple questions in order to better understand the patient's symptom, and then actually perform the required assessment and procedure based on the service that the patient register. So he can try to take the examination and input the result data into our EMR for future review or future data query and qualification. We have set up some of the form for eye care management, including the visual acuity examination, visual or mobility examination as well. And the data is designed in the archetype pattern, so data point is very flat and it is very easy to query in the future. Let me quickly insert the data into each of the form. After taking the examination, the doctor have the ability to provide the final diagnosis for each of the eye, and it is ICD coded. Finally, provide the treatment. The treatment contains of the medication the patient needs to take, and register a follow-up event if it is necessary for the patient to come back to the clinics later on. And the final step is to create a discharge summary for the patient. In this segment, the doctor have the ability to create a final discharge containing all of the information. After the doctor has finished the examination, then the profile is going back into the PAS system, and the receptionist can review and also make a payment. The final payment contains all of the information about the price of each of the assessment procedures, and also the receptionist has the ability to discount for the patient if necessary, and finally confirm and bring the payment. And just like that, the patient journey has completed. And the final step is to export the report. We also have the reporting system for the financial department to review all of the revenue of the clinics. So select the time range. And I think this is it. All of the information is displayed in the repository. So if you need any more information, please contact us for any opportunities working together. Thank you very much for your attention.